Hi, I'm Keisha Lusk, and for this week's case study, we're diving into the mysterious burn victim. The scenario presents a patient with second-degree burns on significant portions of their body, along with concerning inflammation on the surrounding unburned skin. My approach to this case study has been to break down the psychological response to these injuries, focusing on the cellular and tissue level mechanisms at play, and then translate that to understanding into a comprehensive care plan and a meaningful faith reflection. When we talk about burns, we're primarily concerned with the skin, which is the body's largest organ. In this case, we're dealing with second-degree burns, meaning the injury extends to the epidermis, the outermost protective layer, and into the dermis beneath the layer. I have that demonstrated right here. We have the epidermis, dermis, and subcutaneous layer. These two layers are going to be what is affected during the second-degree burn. The epidermis itself is composed of the stratified squamous epithelium. Its main roles are protection against pathogens, UV radiation, and water loss. In a second-degree burn, this layer is compromised, leading to a breakdown of these protective functions. The dermis is a thicker layer, rich in connective tissues, blood vessels, nerves, hair follicles, and it provides structural support, elasticity, and it's crucial for sensation, temperature regulation, and wound healing. In second-degree burns, the dermis is damaged, which is why we see blistering, intense pain due to nerve involvement, and the potential for scarring. The presence of redness and swelling in unburned skin nearby indicates like an inflammatory response. This inflammation is the body's immediate reaction to the trauma, involving the release of chemical mediators like the histamine from the mast cells in the connective tissues of the dermis. These mediators cause vasodilation, which is the widening of the blood vessels, and increase vascular permeability, allowing fluid and immune cells to move into their injured area and surrounding tissues, resulting in redness due to increased blood flow and swelling, also known as edema. The healing of second-degree burn is a complex, multi-stage process. It typically begins with an inflammatory phase, which we've just discussed, where the body cleanses the wound and prepares for repair. This is followed by a proliferative phase where new tissue begins to form. Fibroblasts lay down collagen to create granulation tissue and epithelial cells from the remaining healthy dermis. At the wound edges and within hair follicles, they migrate to cover the damaged area. If the dermal damage is not too extensive, re-epithelializations can occur from these residual epidermal structures. The severe redness and swelling in the unburned skin are manifestations of this acute inflammatory response. It's the body's way of signaling injury and mobilizing its defense and repair mechanisms. This widespread inflammation can occur and contribute to fluid shifts and electrolyte imbalances, which are significant concerns in extensive burns. These intense inflammation can also lead to increased sensitivity and discomfort in the areas surrounding the burn. The prolonged inflammation can sometimes hinder the regenerative responses and processes, making it crucial to manage this response effectively. So the care plan is going to be, for a patient with extensive second-degree burns, a comprehensive care plan is essential. First, you want an immediate fluid resuscitation. It's critical to counteract the significant fluid loss and prevent hypovolemic shock. This involves intravenous administration of fluids and just hydrating the body. Second, wound care is super important. It includes gentle cleansing to remove debris and prevent infection, followed by application of specialized burn dressings. These dressings will help maintain a moist wound environment conducive to healing, reducing pain, and provide a barrier against infection. Next, you got pain management, which will be a priority. Second-degree burns are very painful, so it's important to just kind of take care of that. Next, nutritional support is vital. The body's metabolic rate increases significantly after a burn injury, requiring a higher intake of calories and protein to support tissue repair. Finally, as the healing progresses, rehabilitation and physical therapy will be necessary, just to kind of keep that range of motion and prevent and manage the scarring. To incorporate faith into this, so reflecting on the body's incredible capacity for healing, I'm definitely reminded of the scripture, Psalm 139:14, and it talks about our bodies are fearfully and wonderfully made. Even when faced with severe trauma, there's an innate biological blueprint designed for repair and restoration. This process is sometimes slow, and it kind of mirrors the journey that we have spiritually. It just takes time. This case highlights not only the complexity of human physiology, but also the profound truth that even in brokenness, there is potential for renewal and testament to the resilience woven into our very being. Thank you so much.